Many doctors and nurses and others in the healthcare field do wonderful work. They take care of people. I respect their work greatly, and I think you do. But the system itself is in critical condition and in need of fundamental change, not tinkering, but fundamental change. People don't get up in the morning and look in the mirror and say, am I a liberal or am I a conservative? People want to have some assurance that health care will be available for them, that health care will be affordable for them. And that's really what we're talking about, a health care system that will provide care for people and also a health care system that won't bankrupt our country. You're about to see a documentary on the Canadian system. Now, we wouldn't exactly borrow from the Canadian system, but there's much that we can learn, and I think this documentary will be very informative for you.
All these people, the young, the old, the rich, the poor, are fully insured for health care because they live in Canada, a country that holds health care to be a right, not a privilege. Canadians are covered by a medical service plan known in some areas as MSP, which is paid for by their taxes. The total cost to Canada per person is about 1/3 less than in the United States, where access to health care is neither universal nor a right.
I've had extensive heart surgery, never cost me 1 cent.
We hear things about long waiting lists, though, here.
No, that's not true in Ontario, for sure. If you're sick, you're in the hospital, first-class care, whether you have private room or whatever.
I go to my own doctor. I choose my own doctor. Even if I'm unemployed and on welfare, I can stay going to my doctor, and it's paid for.
Everybody gets the same treatment. You aren't turned away from a hospital because you don't have a certain type of card. I mean, people never hear of things like that here. When you have your healthcare system within the province and even inter-province, I mean, they honor it between provinces, you know, the healthcare is the same for everybody, basically.
I feel that the best aspect of the Canadian healthcare system is its universality. The fact that as a Canadian citizen, as long as you take some responsibility and make sure that you are indeed registered with MSP, which is not a problematic thing to do, as long as you do that, you're guaranteed health care. And that means that if you need open heart surgery, that will be covered by MSP, and if you have a baby, that will be covered by MSP. And I think it's an excellent system in that way.
There's a single payer system, which means that there's only one insurance company, and that's an insurance company run through, although not by, the governments of the various provinces. I bill to the government, to the insurance company. I do not bill the patient. The patient has no, as I said, no out-of-pocket expenses, and in fact it's illegal to do extra billing.
In the U.S. I had a hard time figuring out whether the regulations in Medicaid versus Medicare and one insurance company versus the other insurance company and all of the various state and federal regulations. Here there is only one, and I think that there's a lot of advantages to that.
In Ontario, patients receive a health care card when they are born, and they receive a number, and that's their health care number for life. They get a card. They can go to any physician they like. They choose their own family physicians or primary care physicians and specialists with the advice of the family doctor. They have to only give their health care number, and then as far as any payment, they're pretty well safe.
Everybody, regardless of income, age, station in life, or anything else, has complete coverage for everything that's medically necessary, including some kinds of service that are not ordinarily offered unlimited coverage by healthcare plans. For example, in Ontario, you can have unlimited coverage for psychotherapy.
Being an owner of a small art consulting business in Canada, I feel privileged and fortunate not to have to go to work each day and feel concerned about not being covered adequately with health insurance. As a Canadian citizen, we are automatically covered, full coverage, for any sickness. It makes it possible for small business people like myself to remain in business.
I was covered by the courtesy of the government before I got my first job as an advertising representative after I left high school. So I didn't have to worry about whether I was covered by a health plan or not.
I have not only the one daughter who's been ill for 7 years and has required intensive treatment, We also have another daughter who has a heart defect who's been here at the hospital on several occasions. And with having two children who are actually quite ill, we could be seriously in debt.
Does anyone ever worry about an illness bankrupting them because of the medical costs?
Not here. But well, part of my family lives in the United States, and that is a concern there.
Medical bankruptcy is a peculiarly American phenomenon. The notion that the catastrophic effects of severe illness, cancer, for example, or a stroke that cripples the principal economic support of a household or something like that, the notion that such a catastrophic event should be compounded by destroying the economic resources of the family or the individual seems to, I think, most of the rest of the world to be barbaric.
I'm on the board of the Vancouver Persons with AIDS Society, which is a self-help group for people with AIDS. As soon as you have AIDS, you automatically fall into a different category, and all your drug costs are covered.
Before the introduction of universal single-payer health care in Canada, the proportion of the gross national product that went to health in Canada and the United States was about the same, around 7%, back around 1970. Since that time, healthcare expenditures in the United States have grown at a much greater rate than have healthcare expenditures in Canada. The major way we save money is administrative costs. You don't have to spend resources deciding whether somebody is insurable or not. Everybody is covered, so you don't spend administrative resources that way. There is a huge administrative saving at the hospital level. Hospitals get a global budget from the provincial government. So they get up front at the beginning of the year, here's what you're going to get to run your hospital, and you have to run it within that amount of money. When you go into an American hospital, every blood test you have, every x-ray, every diagnostic test, everything has to be attributed to a patient who is then subsequently billed for those services. That's a huge administrative burden collecting that information.
Most of the money for health care in Canada comes from the federal government. 50% of all of the hospital money and all of the medical services plan money is paid to the province out of the federal government's tax system, and the rest is paid by the provincial health system. When you have really one major payer, then you don't spend a lot of your time chasing the dollars. When you have multiple sources of financial places that you have to go, it takes up a lot of healthcare dollars in administrative time.
If you go to a doctor or hospital, you just have to present the cards?
Present the cards and they just punch it into the computer, and that's the last you hear of it.
So you never see a bill?
No, never.
And what I can say is that I've been pleasantly surprised and impressed with the Canadian system. There are some situations in which patients have to wait for their health care in terms of certain procedures and certain diagnostic studies and that sort of thing. I have not seen any of that actually impact on the patient's health.
Where there may be a problem with long waiting lists in BC, it would be, a good example would be a pediatric orthopedic surgeon. There's only 4 in the city of Vancouver, and they cover the whole of BC, and they're dealing with all the trauma every day, plus they're dealing with very important types of surgery in children with major problems. So if you have a child with flat feet, that the mother insists that you refer this child to a pediatric orthopedic surgeon, the waiting list, yes, can be 6 months or 8 months. But if you have a child, if I have a child that's fallen and I've looked at the x-ray and I think that they have a green stick fracture and that it involves the epiphysis, then it's very simple for me to phone up the surgeon that's on call that day and say, could you please take a look at this child, and they will have a look at it.
In Canada, everything is paid for by the state, so even very costly forms of treatment are available to everybody. That poses a certain demand on the system, so to some degree, if there is from time to time here and there a bit of a logjam in the system, I think that's a price that many of us are willing to pay.
The healthcare facilities in Canada and the U.S. are similar enough that I guarantee that I could take a surgeon from a hospital in Houston and put him in an operating room here in Vancouver, take off the blindfold, and he could carry on with the operation without so much as a pause. The facilities are the same, the quality of the instrumentation that the surgeon would have to work with, the support facilities are, to all intents and purposes, identical.
In Toronto, there are 3 major teaching hospitals that do open heart surgery. I'm only familiar with the Toronto hospital program, but they have a very large open heart surgery program doing, I believe, in excess of 1,500 what we call pumps a year, or procedures which involve the heart-lung machine.
He was born 3 months premature, and he weighed 1 pound 9 ounces, so he definitely needed a lot of this technology to even keep him alive. You just sort of can place your entire trust in the staff here, and you know they're giving them the best care that is absolutely possible. And he's going to grow up and be a big boy, thanks to these people and what they can give him.
Prenatal care in this country is again covered by MSP. They're allowed, I think, 14 visits throughout the pregnancy that we can bill for. Plus, if they need a specialist care, then the consultants get paid on top of that. Any woman who comes to a doctor will get that kind of medical care through a general practitioner, and it will be paid for by the government.
We have a very organized system of immunization across the country. Everyone is immunized. I mean, everyone has the opportunity to be immunized without payment, and we highly encourage it. And they're encouraged from the day they, arrive in the hospital to have their babies that this program will be implemented.
Our overall health indices will stand up well against any international comparison. If you look at life expectancy at any particular age cohort, infant mortality, the whole area of comprehensiveness of immunization programs. I mean, the indices are very good. Patient satisfaction with the system is high. There are flaws in the system. There are cracks in the system, but patients, by and large, hold their healthcare system up with a tremendous amount of pride, almost as a sacred trust.
Would you mind telling us about what you had to go in the hospital for? Was it your foot or your leg?
It was a leg. The ankle had to be rebuilt because it was entirely smashed. And I went 4 times to the hospital, and all 4 times the services, everything was quite great.
The government is not looking over my shoulder. The government has a role in paying me and has some concerns around the quality of the care that the medical profession provides. Legitimately, they're the representative of the population, which are my patients. But the issues of how I practice medicine are up to the medical associations and to myself individually.
In terms of my own practice, I provide the health care that I think personally is necessary. If I decide a person needs surgery, yes, certainly within some confines I need to justify it both to myself and to the patient, but I do not need to justify it to a government official. There's no one that's going to turn around and say, you did that laparoscopy, you didn't need to do it.
Do you get to choose your own doctor?
Yes, I actually have switched doctors about 6 times in the last 4 months because I haven't found one I liked.
So you have freedom?
Yeah. Any different doctor. You can go to as many doctors as you want.
My name is Peter Sinclair. No fixed address. I sleep in a tent. I got a medical card.
So when you walk into a doctor's office or a hospital, are you able to get the care you need?
Yes, I am.
Canada and the United States both have their poor and homeless people. The difference is that in Canada, they are covered with health insurance and have the same medical care as everyone else.
My name is Roy Carlson. Live in Vancouver, BC. I'm a retired machinist. The way it is now, see, the whole Canada or British Columbia contributes this, see? And the people that are well pay for the people that are sick.
The practice of medicine in the United States is skewed according to the economy and to the economic status of the patient. And I'm not willing to give different kinds of services to people according to whether or not they can pay. It violates my sense of humanity, that's for sure.
The care is acceptable to the upper middle class. The system has to be maintained so that the level of care is of that quality that will satisfy them. And it also means that that everyone gets that level of care.
I realize that the United States is ahead of us in many ways, but I think this is one of the areas where you'll probably follow us eventually.
I consider our health system a national treasure, that it's a right we have, and it's beautiful, really.